So here's 5 keys for successful bonding. Remember to agitate the etchant and bonding agents. Be sure you follow the directions on the length of time that you need to use. Remember to use moist dentin. Don't over dry. Apply enough primer and dry until nothing moves. Avoid contamination. Use rubber dam. And of course, we need adequate light curing. So let's take a minute and look at some teeth. So we'll start with probably the most simple type of restoration. Here's a case, a young person that's had some sealants done, and we're starting to see some discoloration. Look at this. We're starting to see dark color underneath the sealant where it's leaking. So we suspect there may be a little decay starting there. Over the years, I remember 15, 20 years ago when the fad was to use these air machines, air abrasion machines to clean these out, and I went through several machines, and they all made a mess, and they took too long to work. So I found that I can use, without anesthesia, use a high-speed, tiny burr. This is a fissurotomy burr from SS White. We can use this to clean those little grooves out without discomfort. So there's no pain here. We're using an isolite to isolate. I can't use a rubber dam because the patient's not numb, and I don't want to put a clamp on this young person. So we're going to clean this out, and once we get the initial area opened up, you can see a little bit of decay still remaining at the very bottom. So now I can use my air abrasion and fairly quickly get in there and clean that out. Now I like this Prep Start air abrasion unit from Danville. It's Danville Zest now. And with just a few seconds, we can clean those grooves out and fill the restoration. So we use our primer, etch it first, then prime it, and then we can fill with a nice flowable. This is, to me, the perfect case for what we call a heavily filled flowable. I really like this GrandioSO heavy flow. It is 83% filled. It's easy to use. It comes in 2 different systems. You can get these little cartridges you can put into your gun, your CompU gun, or you can use the syringe. This is this is kind of thick for this, so you got to be able to push hard to get it out. But both systems are available. It's one of our favorite resin products, GrandioSO Heavy Flow. This is what it looks like when we're done. If it's bonded properly to that enamel, and with this heavy material and a very small fissure, how long is this going to last? 10, 15, 20, maybe 30, 40, maybe 50 years.